question. Well, and this comes up a lot from personal trainers and strength coaches. Um, I have patients or clients that are doing exercise and the exercise is making them worse. So should I just stop doing the exercise? So exercise that's making people worse, even if it's home exercise programs prescribed by a physical therapist, if it's making them worse, it's because you didn't refacilitate the muscles that should be working during that exercise and they're breaking down. That's the whole point of having them come in, do a functional screen, assess individual muscles, facilitate when needed, reassess functional screen, prescribe them specific exercises for what you worked on. That's why we do that. So if I have a patient go home and they do their home exercise program and they come back and say, well, I did my home exercise program and my knee was really hurting. And I say, okay, which exercise was it that made your knee hurt? It's usually lunge walk with a twist. And lunge walk with a twist is one of the most commonly incorrectly done exercises that we prescribe. So I know I have to go back through and double check that I did what I should have done, which usually I'm pretty good at that. And then I have to go and double check that they're doing the exercise correctly, which they're usually not. So they're not taking a long enough step. They're not going deep enough. They're not letting their knee go over their toes. They're not twisting the right way. Something is going on there. So once we correct that, then they'll be like, oh yeah, that feels good. And then when they come back for their third visit, I say, how are the exercises going? Fantastic. No problems. Okay. Now, if you go through and make sure they are doing it correctly and they are having symptoms, that means you missed something. So if you don't know how to do 180, you missed a whole bunch because you don't know how to refacilitate muscles that are inhibited because you don't even know how to test for inhibition. So once you learn those two things, then you can prescribe exercise and they can do all of the exercise and not get worse. So remember, exercise does not fix anything. If eccentric and concentric exercise fixed your problem, nobody would ever get hurt at the gym. Nobody that works out 5 days a week would ever get hurt because exercise would have fixed it. That is not true. Exercise, when done with inhibition, will make things worse and make symptoms increase. So if you're giving people exercise and it's making them worse, you're giving them exercise without first getting to the root cause and reversing that. Other questions. When's the best time to get in the shift and fit lab weekend in there? So lab weekend was originally designed to be at the end of the shift. Since I designed it that way, we've had several people go through the shift and come into lab weekend only a month after being in the shift, and they did just fine. Now, there was a little bit of disconnect. I had to bring them up to speed on some things at the beginning of lab weekend, but they were still fine. Now, I would still suggest if you're going to, when you sign up for the shift, that you plan on being at lab weekend somewhere between 2 and 4 months after you get in the shift. That's when everything will make sense. That's when everything will come together. I've had people come in to lab weekend 6 months after getting in the shift. That last 2 months, they get done with their video modules, and now they have 2 months between the end of the video modules and lab weekend. They're like chomping at the bit because you haven't got the most important thing, which is lab weekend. So that's why it's best to get into lab weekend right around the end of your 4 months after getting in the shift. But you can get in at any time. Lab weekend is included in the price of the shift. Everything you need. Zoom calls, video library, lab weekend, all included in the price of the shift. The only thing that's not included in the price of the shift is if you want to do immersion day on lab weekend where you actually come in the clinic and hang out with me and see 10, 12 patients in a row, live patients, so you can see the 180 system work from one patient to the next patient to the next patient and see how, doesn't matter who they are, I'm doing the same thing. I'm not changing my thought processes. I'm not changing my treatment strategies. Little things are changing, what exercises I give them, what order I might go in, those kind of things. But thought process, treatment is the exact same. It doesn't matter who they are, how old they are, how active they are. If they're pre-op, post-op, doesn't matter. Same process. Okay. So this coming Monday, there's another round of free discovery calls. So if I didn't address your questions or you want to know more about how I can specifically help you, make sure you're on one of those calls. Now, notice that when you get on the sale page, the sale ends Sunday night at midnight. Those discovery calls are Monday, so they're after the sale. So if you don't get into the sale, but you schedule a discovery call on Monday, I will honor the sale prices since you're not on the discovery call until it's over. You will have 3 or 4 hours after we get off the discovery call to figure out what lab weekend you're going to get in and what you're going to buy in the sale, because then the sale will be over for you. So make sure, if you want to be in the shift and be in lab weekend and you have questions, make sure you get to the link below and schedule a discovery call. Okay?